Following your initial patient assessment and control of any immediate life threats, you should obtain a baseline set of vital signs, which include pulse, respirations, skin color, temperature and condition, pupil size and reactivity, and blood pressure. The baseline set of vitals gives you a beginning place from which to make treatment decisions. As you retake vital signs, you will compare the readings to your previous findings. This is called serial vital signs. Serial vital sign assessment allows you to note trends in the patient's condition, such as a declining blood pressure or increasing respiratory rate. A patient's pulse is the rhythmic beats felt as the heart pumps blood through the arteries. When taking a patient's pulse, you are concerned with the pulse rate, rhythm, and strength or quality. The pulse rate is the number of beats per minute. The number you get will allow you to decide if the patient's pulse is normal, rapid, or slow. The normal rate for an adult at rest is between 60 and 100 beats per minute. A pulse rate above 100 beats per minute may be too rapid. A rapid pulse rate is called tachycardia. A pulse rate below 60 beats per minute may be too slow. A slow pulse rate is called bradycardia. Pulse rhythm reflects regularity of the heart beats. A pulse is said to be regular when the intervals between the beats are constant. When the intervals are not constant, the pulse is irregular and can indicate a cardiac dysrhythmia. Pulse strength refers to the pressure of the pulse wave as it expands the artery. Normally, the pulse should feel strong and easily palpable. When the pulse feels weak or thin, the patient is said to have a thready pulse. Locate the radial pulse on the lateral or thumb side of the patient's wrist. You might also use the carotid, brachial, femoral, or dorsalis pedal pulse points. Avoid pressing too hard on the pulse point during assessment. Too much pressure can occlude the arterial blood flow, causing the pulse to seemingly disappear. Assess the heart rate by counting the number of pulses you feel in 1 minute. You can count for a full minute, or more commonly, count the number of beats in 30 seconds and double that number, or the number of beats in 15 seconds and multiply that number times 4. Pay close attention to any irregularities in the rhythm of the pulse, as well as the quality or strength of the pulse, and note both, in addition to pulse rate, on the EMS report form.